Actually, I'm Seung-Hong Choi from Seoul National University Hospital. Today, I will share research and validation experiences of AI-based FastMR scanning, SwiftMR, from university hospital environment. Recently, AI-powered devices have been released in medical field. These devices enable fast diagnosis and facilitate the medical processes. FDA authorizes these devices as medical devices, SAMD. Actually, there is a biggest issue that is FDA cleared does not equal clinically validated. According to this study, 28% of authorized products were retrospectively analyzed, with another 28% prospectively validated. Only 22 of the 521 algorithms were validated using randomized control trials. 43% of algorithms lacks publicly available clinical validation data. AIRS Medical developed and commercialized SwiftMR, that is kind of deep learning based face scanning method. At the early stage of this company, they optimized MR sequence and validated their method. And these days, they started clinical validation and evidence building as a product of SwiftMR. You can see there are many kinds of publications and ongoing studies regarding neuro, MSK, abdominal imaging, pediatrics, even in animal studies. In this talk, I will share research and validation efforts from AIRS Medical regarding SwiftMR, especially on neuroimaging applications. I will show some selected peer-reviewed journal papers, their findings, and sample images. One of recent studies, we showed 2D and 3D brain MR application with SwiftMR in our hospital. In this prospect study, we enrolled 150 patients on mixed MR scanners, including GE, Philips, Siemens, because AIRS Medical SwiftMR is vendor neutral. Even a busy tertiary hospital setting, SwiftMR allows additional 40% in average acceleration of routine MR scans on top of hospital optimized protocols. Image evaluation results show that SwiftMR process accelerated images displayed superior quantitative and qualitative image qualities. We also analyzed volumetrics using AIRS Medical studies. You can see flare, T2 flare images in overall AIRS Medical. SwiftMR processes accelerated images showed higher and better contrast compared with standard images, even after 30% faster acquisition. You can see high contrast between enlarged perivascular space in right facial ganglia and cortical medullary differentiation. In these patients, we also obtained T2 flare images, and this patient showed T2 hyperintensity changes. SwiftMR processes accelerated images shows better and higher contrast between the regions with normal brain parenchyma. And overall, image quality also higher and better compared with standard images. We also obtained T2, 2D T2 weighted images. You can see higher contrast in SwiftMR processed accelerated image compared with the standard images in terms of detection of perivascular spaces and other vascular structures in choroid plexus. We also segmented brain lesions using automatic programs such as Euroquant on both FLAIR and 3D T1 weighted images. Compared with standard images, the white matter regions is more clearly demonstrated on accelerated SwiftMR. In next study, we evaluated SwiftMR in terms of DCE MRI. Actually, DCE MRI is kind of parametric imaging to obtain vascular permeability. In this retrospective study, SwiftMR processed DCMR images of patients with diffuse glioma were compared with conventional images. After SwiftMR processing, all quantitative metrics of DCMRI showed significant increases. Actually, diagnostic performance in differentiating glioma types is comparable or higher across all pharmacokinetic parameters when using SwiftMR. SwiftMR processing showed better and higher contrast of contrast-enhancing regions at the early phase of dynamic study. And SwiftMR also showed a much better contrast of the contrast-enhancing regions at late dynamic stage as well. We also analyzed the parametric maps from DC MRI, such as K-trans, VP, and VE. You can see SwiftMR processing showed higher and better contrast of contrast-enhancing area in terms of K-trans, VE, and VP. It means that the SwiftMR processing can increase the pharmacokinetic evaluation of contrast-enhancing lesions such as brain tumors. In next study, we also used SwiftMR in brain volumetrics. Accelerated MR scans with deep learning-based reconstruction, SwiftMR showed good agreement with conventional scans in both image quality and volumetric measures. Quantitative brain volumetric brain MR in routine clinical practice can be performed with accelerated MR scans by up to 75% reduction relative full scan acquisition, as demonstrated by two brain volumetric software programs, Euroquant and DeepBrain. You can see three images from same patients: standard imaging, accelerated scan, and SwiftMR processed accelerated scan. You can see highest image quality of these three images. It means that after accelerating scan and using SwiftMR, you can see a better and higher image quality. In comparison with standard imaging, for the segmentation, you can see SwiftMR processing is very comparable with standard imaging in terms of volumetrics. In next study, we used SwiftMR for the diagnosis of temporal lobe epilepsy. In this study, 1.5 millimeter thin section images processed with SwiftMR were comparable with 3 millimeter standard images, and region detection sensitivity was significantly higher with 1.5 millimeter images. Image quality in terms of artifacts, sharpness, and structural conspicuity were comparable to 3 millimeter SOC images. We scanned the patients standard imaging with 3 millimeter. It takes about 2 minutes, 42 seconds. In accelerated scans, the scan thickness was 1.5 millimeter, and scan time was reduced to 1 minute, 34 seconds. And SwiftMR processing increase image quality and resolution, and you can see clear demonstration of left hippocampal sclerosis on SwiftMR processed image. In terms of detection, the performance of temporal lobe epilepsy, the 1.5 millimeter with SwiftMR showed highest the diagnostic performance in terms of sensitivity. You can see the 91% in entire patients in terms of hippocampal sclerosis regions, 93%, and temporal lobe regions, 93%. In our hospital, we performed the prospective study for the diagnosis of cervical spine diseases using SwiftMR. In this study, in comparison to conventional imaging, the accelerated imaging reduces scan time by about 50%. After processing with SwiftMR, the accelerated images demonstrate comparable or superior quantitative and qualitative image quality metrics for most parameters compared with conventional images. You can see conventional and Swift process images in T1 and T2 and contrast T1 weighted images. These two image sets shows the comparable image quality. In terms of spinal stenosis and neuroforamen stenosis detections, the SwiftMR showed the comparable image quality with conventional images. In the next study, we continued lumbar spine imaging using SwiftMR. In our hospital, lumbar MRI was accelerated by 32% using SwiftMR. Resulting SwiftMR processed images were equivalent to standard images in terms of quantitative and qualitative image quality and diagnostic performances. We enrolled two MR scanners, 1.5 Tesla Philips and Siemens scanners. We reduced scan time about 31% in overall. And we compared image quality between standard images and SwiftMR accelerated scans. You can see less noisy and higher resolution images after SwiftMR processing. And left to the neuroforamen stenosis is more clearly demonstrated on SwiftMR compared with standard imaging. In terms of T2-weighted images, you can see more clear spinal stenosis at L4-5 level and on SwiftMR, and you can see the higher and better resolution of contrast of chora equina on SwiftMR processed images compared with standard images. In next study, this study was performed in other hospitals. SwiftMR used for time-resolved 4D MR angiography. Overall image quality in terms of noise, sharpness, and vascular conspicuity has improved with SwiftMR. In terms of diagnostic performance, the aneurysm detection accuracy and size measurement has improved with SwiftMR. And the confidence level in diagnosing large vessel occlusion was significantly higher, and decision-making time was shorter with SwiftMR. In these patients, 4D twist MR angiography was performed before stenting. You can see clear demonstration, severe stenosis at left carotid artery and other vascular structures on SwiftMR compared with 4D twist MRI. And we compared the SwiftMR angiography with the 4D twist MR angiography. You can see more clear demonstration of aneurysm, and this aneurysm is very comparable with small FOV TOF. It means that the 4D MR angiography can be used for intracranial aneurysm detection. We also used SwiftMR for the diagnosis of vascular imaging. In last week, SwiftMR vascular imaging showed significant improvement in overall imaging quality, both quantitatively and qualitatively, compared with conventional vascular imaging. SwiftMR processed vascular imaging led to increased neurologist confidence in detecting atherosclerotic lesions, and particularly demonstrated better sensitivity and specificity in identifying potentially culprit plaques through the evaluation of intraplaque hemorrhage and plaque enhancement. After processing with SwiftMR, noise was much less compared with standard imaging. You can see clear demonstration of intracranial vessels at SwiftMR. And SwiftMR increased the detection level of the intravascular hemorrhage T1 hyperintensity, which looks eccentricity. And you can see the more clear demonstration of intraplaque hemorrhage T1 hyperintensity on SwiftMR compared with standard imaging. In conclusion, SwiftMR has continued clinical validation and technical improvements. SwiftMR can improve MR image quality by improving RSNA and spatial resolution. SwiftMR can enable scan time reduction for MRI while preserving diagnostic image quality. SwiftMR is helpful for both MR scanner workflow as well as radiologist performances. SwiftMR is expanding collaboration with academic institutions to demonstrate clinical validity and facilitate trust in our technology. Thank you for your attention.